This presentation is on non-governmental organizations, also referred to as NGOs, as presented by Robin Metcalf. So what are NGOs? They are independent of the government and have a 501c3 designation. The 501c3 designation by the IRS obligates them to use profit for organizational matters rather than for private purposes. They are a voluntary citizen group driven by a common mission and passion for a specific topic, and they are often focused on social issues. And common examples include the American Red Cross, Habitat for Humanity, the Salvation Army, Catholic Charities, and Doctors Without Borders. It's estimated that there are 1.6 million NGOs in the U.S., and about $430 million each year is transferred from the federal government to the nonprofit sector. So the values and qualities of NGOs, first off, they're independent from the government, which I mentioned before, and they are practice-oriented. The independence allows them to offer a scope of services that they would like rather than being told what they need to offer. They also have knowledge and resources that can be utilized before and after a disaster, and they have focused efforts, which means they can focus their effort on addressing a specific issue at hand unless they're of a very large scope, such as the American Red Cross. For example, their main purpose may be to provide emergency shelter to victims of a disaster rather than addressing all of the needs of the victims. They're present during all stages of a disaster, and they're driven by a specific interest or mission, which is typically to help others. So examples of emergency management services provided. This is not a full list. The list could go on and on, but these are just some of the most common services that they offer during emergency management. So this includes emergency shelter to victims of disaster, providing food assistance, medical and first aid assistance, assist or provide the logistics for response and recovery, provide transportation for victims, search and rescue, healthcare, and psychosocial care. So some examples of psychosocial care, there's distress problems for victims. This is because people have concerns about the disaster that took place. This is very common, and they look for guidance on topics like talking with their children about the disaster or how to support friends and family members that have been affected. Next is moderate distress. Many victims will experience worry, distress, sadness, insomnia, anger, or other psychological well-being issues after a disaster, and NGOs can provide them with strategies for addressing these problems. Finally, there's significant mental health problems, and these are diagnosable mental disorders, most commonly PTSD, depression, complicated grief, anxiety, or substance abuse. So there's a need for NGOs to coordinate with other providers when responding to an emergency. NGOs, they have to coordinate with governmental services especially, and the purpose for NGOs and their role in emergency management is they're really there to fill the gaps of services that the government is unable to provide for by minimizing duplication of services. Coordination also allows for the sharing of equipment and decreases the chance that there'll be areas not covered before, during, and after a disaster. For example, there might be a rural area that's not being addressed directly by the government, but that an NGO can come in and directly serve that population living there. And there's also a need for coordination operating centers just to make sure that everybody is on the same page and filling the gaps when needed. So the pros and cons of NGOs' involvement in emergency management. The pros is that they're accountable only to the population that they're serving. There's less scrutiny compared to a government agency, and it's unlikely for there to be a misuse of funds or criticism about the structure of the services being offered. But the con would be that there's limited funding. Most NGOs receive their funding through grants or through donors, and this can not always be a permanent pool of money, and they might go from year to year not knowing how much funding that they will have. An example of a large NGO that's most commonly known when people think of emergency management and NGOs is the American Red Cross. This information comes from their website, and their mission statement is to prevent and alleviate human suffering in the face of emergencies by mobilizing the power of volunteers and the generosity of donors. There's 2 million volunteers across the U.S., and they respond to an emergency every 8 minutes, both on the local, state, and federal level. They provide shelter, food, health, and mental health services to help communities and families get back on their feet. And finally, these are just some considerations and questions to take with you. The first question is, do you think that NGOs should play a larger role in emergency management and the government should play a smaller role? The next question is, do you feel that there is a need for more NGOs that focus directly on emergency management services? And finally, what issues could arise if NGOs were the only type of organization that played a role during disaster relief? And finally, these are the references for the presentation. Thank you.